a backup plan. Sometimes, I mean, if
No, that's really good. That's really
because
good.
Every time I was joining with mobile only. Your meeting, every time I was joining with mobile only. This is
now
the first instance.
You are telling me, let me also be ready with that backup plan.
Half an hour before Dhiren, there was a loud noise. Some procession was going on my lane. And I was little worried. I have to go to someone else's place to connect. But fortunately, that passes.
Okay, good. But Zoom has a very good backup option. Like say in the audio, you can go and blur the, diminish the backup sign. Yeah, noise cancellation is there. Yeah. Background noise cancellation is there in Zoom.
Okay. What is the group strength? Normal?
Normal group strength is 95.
95.
Usually we have around say like 38 to 40 members. They actually join.
Normally 40 members are joining.
Yeah, 40 members.
Right. That's good. Only from Gujarat or outside Gujarat also?
No. Like say we have like Dr. Raghavendra is from Kanpur. Then we have from Delhi, from Chandigarh.
Right. Well, almost 50% must be doctors, 50% non-medical?
No. It's like around 30-40% are doctors.
30-40% are doctors. Right.
I think Sri Vidya Ben is from USA. Is it right, Sri Vidya?
She's also joining?
Yeah, she has already joined. Like she's from USA.
Sri Vidya is Bangalore.
Bangalore, okay. Then there is someone from USA also. I forgot the name. The lady
who took the Odisha
talk.
Karnav bhai, kem cho?
Good evening, Tejas bhai. All well?
Haji.
Right. Haji. Great. You're doing good activities. Saras thaya છે બધા. Topic selection is also good. ને બધું ધીરેન મને જુલાઈમાં વાત કરી હતી, પણ મેં કુના it's good definitely. પછી Dhiren told me last month, will you like to share your story?
Yes, nice.
Sure. After so many efforts after 15 years, I am now in remission. Me and Dhiren decided.
It is good that you are using the word remission. કારણ કે reversal or cure of diabetes. I think
that I have discussed with Dhiren. We should not use the reversal.
They are misnomers, yes.
Misnomers.
Diabetes is a metabolic disease. You can't cure it.
Right.
You can cure hyperglycemia, but not diabetes.
Right. That is true. Like asthma. Asthma, we cannot say it's cured. It's in remission. All chronic diseases.
Yeah, good word. Yes.
Yeah.
All my best.
Okay. Thank you so much, sir.
Yeah, OrthoTV person, are you ready?
Sir, we are ready. If you are ready to go live.
Just tell me, it's like 1 minute to go. I will start sharing my screen first.
Okay. Okay, sir.
Yeah. Yes. So when it's ready, let me know.
Yes, sir. We are going live in 5, 4, 3, 2, 1. We are live now.
Good evening and warm welcome to another session of Story to Tell group. And this is our 10th lecture. And today we have a very interesting topic. The title is, how did I bring my diabetes into remission? A lot of people have a lot of doubt about the topic, and they were really asking us that, is it true or it's hypothetical? So let me give you a brief background about diabetes, and then we will go to the main part of the lecture by Dr. Karnav Desai. So first of all, what is diabetes? Diabetes, in a simple word, we all know that it's a increased blood sugar or blood glucose. there are three most popular tests which we use currently for diagnosis of the diabetes. The first is fasting blood sugar or fasting blood glucose, in which we ask person to remain fasting, means not taking anything for 8 hours at least, and then we measure the blood glucose by taking a sample from the vein. If the blood glucose is less than 100 milligram, then we say that this person is normal. If blood sugar or blood glucose is between 100 to 125 milligram per 100 ml, then it's called a pre-diabetes, a stage which is likely to go for a frank diabetes later on in the years. And if blood sugar is more than 126 milligram, then definitely the person is labeled as diabetes. The another test which has not become very popular because one has to go to a laboratory probably in the afternoon, but that is you need to take 75 gram of glucose, and 2 hours after that the blood glucose is measured. If it is less than 140 milligram, then it's called normal. If it is between 140 to 190, then it's called pre-diabetes. And if it is more than 200 milligram or more, then it's called a diabetes. Currently the very popular test, because what happens, like when they know that they are going to check their blood glucose, they usually try to avoid sweet food or the carbohydrate rich food in last 2 or 3 weeks. So now there is a very good test in which we get an average of around 100 or 120 days. And that's the test known as glycated HbA1c, in which if it is less than 5.7, it's called normal. If it is between 5.7 to 6.4, it's called prediabetes. And if it is more than 6.5, it's called a diabetes. The question is like, why we kept this lecture? Is it common? Let me give you, first of all, statistics of USA, which is really shocking to everyone. In USA, 14.3% are diabetic and 38% are pre-diabetic. If we add these two, it comes to approximately 52%. So 50% of US population is either diabetic or pre-diabetic. The next question is, what about India? Definitely India is better than USA, but in rural India, where the obesity is not that much, the prevalence of diabetes and pre-diabetes is approximately 15%. And in Western India region, it's estimated, or the prevalence is approximately 25%. So 1 out of 4 Western Indian person is diabetic. That's really a high number. The next question, which a lot of people, they say that why do we really need to worry about hyperglycemia or diabetes? Diabetes affects a lot of system in the body. It affects the blood vessels, which carries the blood. It also affects kidney, which is important for excretion of waste product. It also affects eyes, brain, and nervous system of our body. So it has a very large areas of the body which are affected by diabetes. And this results into a gangrene where a part has to be chopped off, or it may lead to stroke or a paralysis. Sometimes it leads to heart attack or blindness or kidney failure. So these are the serious conditions which are directly or indirectly because of the diabetes. However, they are seen in like a small number of patients after 2 decades of diabetes. And the most important thing, if we control our blood sugar, then definitely we can avoid these complications. So this leads to increased possibility of infection, obesity, sexual disorders in a younger population, cancers, and a lot many other complications. Now, till now, even I was under the impression that diabetes is a chronic condition and it's slowly progressive, means over a period of time, the condition is going to go or going to get aggravated with years. So initially you need one medicine, then medicines are added, and after few years you need insulin, and then you need to increase the dose of insulin. However, in recent year, it has been realized that it's possible to stop the progress or to some extent reverse the changes. And today we are going to listen from Dr. Karnav about this. The first of all, like we have used the word remission. Remission means we are able to control the disease without any medicine. But that does not mean that we can eat everything. We have to take care of the food, we have to carry out exercise, and we have to take care of other factors which Dr. Karnav is going to tell us. So remission is a control of blood sugar without medicine. Remission is not cure. There is a lot of difference between the two. Cure is used when you don't need any precautions. That is the word cure. So we are not saying that we can cure diabetes at this stage, but definitely we say that remission is possible. Remission is not reversal, means like 20 years you have not taken care of your diabetes and the blood sugar has remained high and it has caused a significant damage to the kidney, heart, eyes. Then it's not possible to reverse all the changes. So what we are going to discuss is remission. We are not talking about reversal. A word of caution: if you are diabetic and if you are under the care of physician, please consult your physician before you bring the changes which we are going to discuss today. Your physician is the most important person for your diabetes management. So please follow the suggestions and the guidance of your physician. We will try to make sure that we avoid medical terminology as far as possible. And we assure you that we will try to make it as simple as possible in a jargon-free manner. And whatever we are going to discuss is about type 2 diabetes. 90% of the diabetics are type 2 diabetes. And if your diabetes has appeared after the age of 35 or 40, then probably it is likely that you are having type 2 diabetes. Let me give you a brief introduction about Dr. Karnav. Dr. Karnav Desai is MD Pediatrics. He practices in Ahmedabad for last 32 years. Karnav Desai has a very balanced way of managing the patients, and also he is very balanced in his approach to the medicine. He is very curious person and very inquisitive, and he reads a lot about a lot of subjects related to medicine and non-medical topics. And today he is going to tell us about his own journey, about how he brought his diabetes into remission. So few weeks back, I was talking to Karnav, and I just casually asked him, Karnav, how is your diabetes? And he said that, Dhiren, my diabetes is now under control. My glycosylated hemoglobin is less than 5.7. So I just asked him that, which medicines you are taking? He said that this is without any medicine. And that was my first experience of hearing from someone that diabetes can be managed without medicine. And that also after 15 years of diabetes. So let's start with the question and answers. So this is going to be in the form of questions and answers. And I will try to ask few basic questions to Dr. Karnav about his journey towards diabetes. So Karnav,
Yes,
first of all, we should like to know about what was your diabetes, when was your diabetes was first detected?
First of all, thank you so much, Dhiren, for kind introduction and for inviting me on your podcast and giving the opportunity to share my journey towards diabetes remission. Good evening, friends. As Dhiren said, I'm practicing pediatrician and I will become a senior citizen this August. So I'll be completing 60 years. Today, I will share with you my journey and fight against diabetes. This definitely will help some of you or some of our relatives. I was fairly healthy throughout my school and college years. In fact, hardly getting sick, not even having common cough and cold. In fact, I only had 2 significant illnesses in my life till 2007. Once I got malaria when I visited my aunt's house in Kanpur. Maybe that may be endemic during that period. And another illness in 1995, I was infected with chickenpox, as I saw many patients of chickenpox during that time in my OPD. So these 2 are the only significant illnesses during my entire 30-40 years till 2007. Then what happened in 2007, in a span of 2 months, I had 3 episodes of febrile illness without having precipitating factor. I was feeling chronically fatigued and also having some minor skin infections like boils. So I consulted my physician friend and basic investigations were done. The result was shocking. My fasting blood sugar was 145. My postprandial blood sugar, that is PPBS, was 235. And glycolated hemoglobin, that is HbA1c, was 7.9. So I was temp diabetic at the age of 44.
Yeah, Karnav, so yeah, please.
Yeah. It was absolutely shocking to me because my parents were not diabetics. Even my grandparents were non-diabetics. I was otherwise healthy adult, weighing 64 kg at that time, corresponding to about 23.5 or 24 BMI. That is fairly healthy for even Asian people. And I was not even fond of sweets. And as Dhiren, you know, we were taught in our medical school that diabetes is a chronic debilitating disease and has a malignant potential to devastate our entire body. Practically no organ system remains unaffected by diabetes. And then a whole list of dreaded complications, as you said, like stroke, blindness, heart disease, kidney disease, foot ulcers, and gangrene were flashing across my mind. In fact, I also remember the suffering of one of my relatives, my mother's aunt, who was diabetic and was on insulin for many years. She initially developed non-healing ulcer over heel. Dressing lasted for a few months, and ultimately it led to gangrene. First, there was a below knee amputation that also got gangrenous, and then above knee amputation. And ultimately, she died within a year. So yes, I was really frightened.
Yeah, Karnav, what you said is absolutely right. I remember your aunt, like we used to go to check her when we were in the internship.
Right, she was admitted in BS hospital. We were undergraduate students.
So that was also my first exposure to any amputation patient. And naturally, when we know the complications of diabetes, and when we get diabetes, all the complications, they start appearing in front of our eyes. Now, I would like to know what were the precipitating factors, or what do you think could be the reasons for your diabetes? As you said, your BMI was good, 23 or 24, which is reasonably normal BMI. Then what could be the reasons?
Yeah, it's a good question. Initially, I thought that the disease was because of stress and my sedentary lifestyle. As I said, I don't have a family history. But I would like to mention, in 2006, my father had chikungunya, followed by acute transverse myelitis. He became paraplegic for non-medical person, both lower limb paralysis, and was bedridden for almost 13 months. So during those 13 months, I had to balance my professional work and family life, along with his nursing care, doctor's visit, frequent hospitalizations. Really, I was stressed and sleep deprived for almost a year, till he passed away in 2007. So I thought my diabetes must be due to stress and lack of exercise. Really, basically, I was hardly doing any exercise before that, very sedentary lifestyle. But during pandemic, after reading some health books and listening to various podcasts, now I realized there were multiple factors. Like I think I was eating a lot of simple carbs. I was very fond of fried snacks like masala puris and mathias and sev chavanu and like that. Even I was very fond of that dhani mamra, what you call puffed rice with corn. I was very fond of that. Even eating 1 to 2 katori every day. Even with lunch, I was having dhani mamra, and sometimes with dinner also. I also used to eat a lot of breads, regular sandwiches in the morning. So now I realize that my fiber intake was very low. My protein intake was also very low. And one more thing, I was also drinking lots of soda, mainly thumbs up, for a fairly long time. For few years, I used to have thumbs up with every meal, even at home. So I now realize that reasons for my diabetes were obvious stress and sleep deprivation, then excessive consumption of soda and simple carbs, frequent snacking, main 2 meals, then breakfast, mid-morning snack and evening snack. So a lot of snacking and less fibers and protein in my diet. So according to me, these were the, I think, culprit for my diagnosis.
So probably soda or aerated drinks, the frequent eating, a lot of carbs could be the reason. And again, as you said, the stress, lack of sleep deprivation. So all these factors could be the thing. So how did you decided to manage diabetes? Because most of us know that a diabetes means we need to stop eating sugar. So how did you start managing your diabetes?
Yeah, initially as a standard therapy, I was prescribed single molecule, most common is metformin. And I reduced my consumption of simple carbs, rice and sugar. As I said previously, I was not eating even sweets that much, but even though I reduced rice, sugar and simple carbs, then I started walking for about at least half an hour in the morning. I followed these simple measures for a few years. Still my HbA1c was above 7. So after a few years, one more drug was added because my HbA1c was not coming in below 7, pre-diabetic range. I further restricted my added sugar. I started having my tea or coffee without any sugar. After advocating these measures for a few more years, I used to maintain my HbA1c between 6.5 to 7, but still it was in the diabetic range with 2 medicines. So I was little worried.
Okay, so then from 1 medicine to 2 medicine, and then even with walking, there was no control in diabetes. So what was your next step, or like how did you progress or your treatment towards the diabetes or approach to the diabetes?
Right. As I said, I was definitely worried because 2 drugs and still it was not coming below 7. Then the COVID pandemic strikes. During early lockdown, we were all confined to home, which gave me ample time to start reading. I started reading the book Diabetes Code by Jason Fung, which was suggested by my physician friend. I think you also told me to hear the famous lecture by Dr. Robert Lustig, Sugar the Bitter Truth, on YouTube. Both suggested that diabetes can be reversed. Then after some time, I also read another book named 4 Pillars for Optimum Health by NHS physician in London, I think Dr. Rangan Chatterjee. And then my journey towards diabetes remission started. I worked on all factors important for optimum health. I said only drug and sweet restriction is not suffice for control of diabetes. So I started my exercising more. I started walking about 8 to 10,000 steps a day, not at one go, but during different times of the day. I stopped sugar and jaggery, even my regular meal. So I want to reduce added sugar, not raw sugar, but also in meals. Then I reduce my intake of simple carbs and starch like rice, bread, pasta. And in fact, I totally stopped taking those famous puffed rice that for me, dhani mamra, my favorite item. I also included breathing exercise in pranayam in my daily activity. I used to relax for at least 10 minutes after waking up in my terrace and doing some basic stretching exercise and breathing exercise. One more thing, now I started to take adequate sleep at least for about 7 hours. Previously, I was having late dinner about 9:30 or 10. And I think after that, watching some, TV or some Netflix serial or like that. And I was sleeping at about 12, 12:30. And routine 6:15, I have to get up. So I may be sleep deprived for a few years. But after taking all the measures, as suggested by Dr. Rangan, that diabetes management is important, not only drug and sweet restriction, but you have to work on all factors like how you eat, how you sleep, how you move, how you relax. And after taking all the measures simultaneously, my medications were again reduced to single drug. And my HbA1c was hovering between 6 to 6.5. Then during pandemic, I further came across the book Glucose Revolution. I think it was also suggested by you, bioscientist Jessie, who is also known as Glucose Goddess, where she very well explained how to flatten your glucose curve and reduce glucose spikes. The book mentioned that walking after every meal for at least 10 to 15 minutes definitely reduces glucose spike. So I followed that. In that book, one other glucose hack was mentioned that if calories remains the same, but if you change the sequence of the meal, then it definitely reduces glucose spikes. So ideal sequence of your meal should be, you should eat veggies and fibers first, protein and fat second, and then starch and sweet being the last. So even if your meal composition remains the same, and if you change the sequence of food, then you can reduce your glucose spikes by about 50 to 70%. I also started implementing this hack in daily life. One more thing, I read book by Dr. Sachin Panda, who is not a medical doctor, but who is a scientist, and he has worked a lot on that circadian rhythm. Our body works on a particular rhythm, the biological clock. In scientific term, we can say circadian clock. He said that what you eat is less important, but how you eat and when you eat, it is more important. He said, you all of must be knowing this intermittent fasting at present is very famous. All our people are doing, but that is for 16 hours. It varies. But ideally, what Dr. Sachin said, you should it should be time restricted eating. He was using another word, not intermittent fasting, but time restricted eating. A time restricted eating, maximum you should eat within a window of 10 to 12 hours. Best is 10 hours, but 12 hours is fine. In his lab, he experimented on mice, two groups of mice. In one group of mice, he gave them unlimited food access, and they were eating like up for 15 hours, 16 hours, or like that, unlimited. And another group, that intake was limited to 8 to 10 hours only. They were given access only for 10 hours to the food. What was the observation? Time restricted eating mice were very healthy, and those who were eating the same number of calories, no difference in caloric value, but even though they became obese and then other metabolic disorders, they found. So time restricted eating is very important. So I started taking my dinner early. Even I changed my consulting hours. I make sure that I'm free by 7:30, and I came home at about 8, and immediately I will take my dinner. So my dinner will be over by about 8:15. And in the morning, I take my breakfast around about 7:30 to 8. So I will try to keep my 12 hours window. And one more thing, Dr. Sachin Panda says,
eat more carbs. Ultimately, it will be converted into glucose. And for managing the glucose in the body, our body needs insulin. The problem in diabetic patient is that either body is not able to produce enough insulin, or body has become resistant to insulin. So if we want to control diabetes, then I think that we need to cut down the carbs. So Karnav, can you tell us about like what changes you brought? So let's start with the most common one, which everyone is aware, sugar. So you curtail down your sugar intake absolutely zero, or still you take some sugar?
Added sugar zero. Added sugar zero.
Added sugar zero. So no sugar in tea or coffee.
No sugar in tea and coffee. And I'm eating little pieces of dark chocolate after my meals. That is Amul chocolate, 75%. So in that one piece, I think 1.5 gram sugar is there. I'm taking 2 pieces of that. So I think my added sugar must be, I think, less than 10. Added
Less
sugar.
than 10 per day.
Carbohydrates may be more, but added sugar 10 to max 15.
Okay, good. So that is first thing. Now, a lot of people, they have a question that we crave for sugar. And if we stop eating sugar, then we need to substitute it with something. Let's start with a saccharin or a stevia or a aspartame. So these sugar replacement molecule, are you taking those molecules or you're not taking those molecules?
Initially for, I think, 6 months to 1 year, I was taking sugar-free in my tea and coffee. But after that, I stopped completely because I read some articles. Previously, it was, I think it was leading with, linked with a carcinogenic effect. But latest research says there is no risk for carcinogenic effect of this. But what happens, Dhiren, when you take a sugar substitute, though they are not having sugar, but they are definitely sweet. So our brain will receive the signal that something sweet is coming. It cannot differentiate. Our gut mucosa even cannot differentiate between this sugar substitute or sugar. As you know, our gut is having, gut-brain connection, and brain think that sugar is coming, and brain will give instruction to pancreas. Sugar is coming, start producing insulin. We will need it. Then insulin production will be raised after taking the sugar substitutes. But there is no sugar. So insulin, I think, may reduce blood sugar level. And after few hours, rebound hypoglycemia, you crave more sugar. And another thing happens if you are taking 0-calorie drink. And so you are, I think, falsely, positive, I'm having 0 calorie. So you are having another food more during that day that you may not be knowing you are eating more on that day. And third thing is that this sugar substitute has, deleterious effects on our gut microbiome. Our gut microbiome functioning is disturbed by this sugar substitute. So ideally, we should not take any sugar substitutes. If you want to take sugar, take little bit of sugar instead of sugar substitute. That's my view.
Okay, so that is about your views about the sugar substitutes, that it's better to take a small amount of sugar rather than taking a sugar substitute. Okay, then coming to the next point about the fruits, because as we discussed in our one of the past webinar, that fruits are also a big source of sugar. So what are your views on that?
Yeah, definitely. Fruits are a source of sugar, but what God has made, fruits, they have given fibers with it. So it's dilutes the effect of sugar, because if you eat fruit as a whole, the sugar in its fruit, that is main fructose, it will absorb very slowly, and the deleterious effect of sugar will be diluted. But if you juice the fruit, then all your fibers are removed. So what is remaining? The pure sugar. It will increase your insulin level, sugar level, and then after a few hours, it crashes, and again you are hungry for another serving. So ideally, according to me, frankly, fruits are overrated. You should take fruits in moderation only. Take one fruit a day, weighing about 80 to 100 grams. Fruits are also of two types. Some fruits are having a low glycemic index. They contains more fibers, so glucose spike will be less, like apple, pear, kiwi, oranges, strawberries, and cherries. Those fruits are good in moderation. But some fruits are having high glycemic load. It spikes sugar a lot, like mangoes, grapes, bananas, watermelon, pineapple, because they are having less fibers. Watermelon is having less fibers. So there is no satiety signal. You are eating more and more. You are not knowing you have completed 2 or 3 plates of watermelon, and only you are having sugar in it. So these high glycemic fruits should be avoided. A low glycemic fruit, as I said, in moderation. One more sentence, I should say or not, but one article, one research says, fruits have no place in our healthy diet or normal diet. Because if you are taking adequate vegetables and adequate healthy diet, so you will get all micronutrient and phytonutrient which is present in fruits. that you can get from vegetables. This may be, I think, very early to say like this statement, but according to strict no for juices. You can have cut fruit only.
Okay. Then one important point is like we need to have at least 2000 calories per day. Now, if we reduce our carbs proportion, in that case, we need to increase either protein or fat. So how do you manage that?
Yeah, we can increase fat. I think in 1982, I think before 1982, there was a recommendation of dietary fat. You can have 40% of your total calories from fat. But then something happened and they reduced the recommendation later of, I think recommendation quantity of fat to 30%. Because during those 80s and early 90s, they were thinking, I think fat was the culprit of coronary artery disease epidemic. But after so many years, even American Heart Diabetic Association and American Association revert that, and they now, I think, give green signal to dietary fats. So fats are good. A culprit is not fat. Even for, I think, coronary artery disease, I can discuss something. If you are taking high sugar, so what I think your liver will do to it, something it will give, all cells will, I think, take up the glucose for their normal functioning. So added glucose will be stored in liver as a glycogen. But you are exceeding those limit also, then that glucose will be converted into triglyceride, and also extra glucose will be converted into uric acid. So those two byproducts of excessive glucose are harmful in the long run. And that triglyceride travels to the coronary arteries, and plaque formation is there definitely. And I think what they will say, that plaque formation contains this cholesterol lipids. So lipid is the culprit of increasing coronary artery disease. But association is not always causation, as you know. When you see at all accident sites, ambulance is there. So can we say that ambulance is the culprit of that accident? No. So in plaque, you are seeing this cholesterol, but cholesterol is not the main culprit. Excess sugar is the main culprit that converts into triglyceride, and that predisposes to the plaque formation. So we can increase our fat content. Healthy fat contents are fine. I think in my diet, I will say later on. But I am taking healthy fats. I am taking even cheese. I am taking even butter. I am taking nuts. Nuts also contain good fat. And I also take dairy, a good amount of dairy, about 400 to 500 ml in either tea, coffee, divided into 2 to 3. So we can increase our fat content up to 50%. So what we can say, 30 to 35% of our calories should be from carbohydrate, 15 to 20% from protein, and 40 to 45% from fat. And regarding those carbohydrate content, we should divide. At one meal, you should not take more than 40 to 50 gram of carbohydrate in one meal. In a day, you can have about 150 gram of carbohydrate. That's fine. As you said, we have to complete 1800 to 2000 calorie. But yes, we can have increased fat content and still we can be healthy.
Okay, Karnav, now what you said is like, we would really like to know about your diet. Like say, starting from your breakfast, what do you eat? Because a lot of people have a doubt that if you avoid carbs, then probably nothing left in our diet. And particularly for our vegetarian people, there is nothing to eat. So can you tell us about your routine diet?
Yeah, sure.
There will be some variation. We know that day to day we have some variation, but just can you give an overview of your diet?
Right. As I said, I religiously follow the practice of eating only in a 12-hour window, right? And I take less meals. I take only 3 meals in a day, lunch, dinner, and breakfast. Breakfast is an important meal. But as I am following that Sachin Panda, I am not eating breakfast immediately after getting up. I usually wake up at about 6:15 after finishing my routine, and I'm going to my terrace for some pranayam, breathing exercise, and walk. And usually at about 7:15 to 7:30, I am having my breakfast, a large cup of tea with soaked almonds and walnuts at 7:30. Then before leaving for my work at about 8:30, I am having my major breakfast. But as you said, I am vegetarian, but I am having eggs. So my breakfast is I am having a cheese omelette of 2 eggs or boiled eggs. So with healthy serving of some onions, capsicum, tomatoes, corianders. So I'm eating that at 8:30 with another cup of tea. Yeah, that's my usual breakfast. For lunch, as usual, ghar ka khana, but I am having a large portion of salad first with a large glass of buttermilk or full katori of curd. Then I will have my veggies or sprouts, whichever is, I think, at that day. And and last, either bajra roti or 2 or 3 wheat roti with dal and remaining vegetables. So I change in sequence also. And then in the evening hours, I again have my tea or coffee with small nuts, nut serving only. I'm always carrying a small box of nuts, only pistachio, walnuts and almonds, not cashews and other walnuts. And for dinner, usually, as I said, ghar ka khana, but with a few healthy modifications. I always instruct my cook or my wife or my daughter to make change in my regular food. If they are going for plain paratha, I will ask them to make vegetable parathas for me, plenty of vegetables, that is stuffed paratha. If they are planning khichdi for some day, I would advise to make them fada khichdi, that is some grain, as you must be knowing. They are making lapsi from fada also. That is complex carbohydrate. Fada khichdi, that is also with lots of vegetables. And my daughter is fond of pulao. So at least once in a week, we are having pulao. But in pulao also, we are adding lots of vegetables. So that's vegetable pulao, not plain pulao. And with vegetable pulao, I am having a healthy serving of curd also. Once in a week, sometimes they are having handvo, that is fermented, you must be knowing. In handvo also, we are adding vegetables. So in fact, in everything, we are adding vegetables. So I don't eat naked carbohydrate. As Jesse said, you should not eat your carbohydrates naked. You should always cover it with either protein or fats or fibers. Sometimes in even South Indian food, I prefer uttapam over dosa, because in uttapam, I can have plenty of onions, capsicum and tomatoes over it. And remaining one thing, my daughter is very fond of pasta. So once or twice in a week, she is making pasta. But whenever she makes it, I suggest adding plenty of veggies in it. 50% pasta, 50% vegetables, and healthy serving of olive oil in it. So sugar effect will be diluted. So as I said, I make sure that I'm not eating naked carbs. Always cover it with proteins, fats, veggies, and fiber. And if I'm going for a party or some wedding function to attend, I only have salad and dal or sprouts. I avoid totally roti, paratha, and rice over there. One interesting incident, when we attended some family function, I was taking plate. Besides me, my wife's cousin was taking plate. She was shocked after seeing my plate. I have covered half of my plate with salad, and in half of the plate, 2 katori of dal. That's it. That was my dinner that night. Then my sister-in-law was saying to all, don't go with Karnav Bhai to any function. If you go, don't eat with him. Otherwise, you will feel definitely guilty. So that's my routine diet, I think, for weekdays and weekends.
Yeah, thank you, Karnav. Like, say, now we are running out of time, so we will have a quick questions. What is the role of exercise in your this regimen of diabetes, anti-diabetes strategy?
Yeah, it's no secret that exercise is must for controlling your sugar levels. Reason is simple. During exercise, your muscles contract and they need energy for this process. They get this energy by sucking glucose from your blood, and it helps it to reduce our blood glucose level. In fact, during exercise, our muscles don't even require insulin for glucose uptake. according to WHO recommendation, we need at least 150 to 180 minutes of moderate exercise or 75 to 90 minutes of vigorous exercise in a week. But you should also, I think, have 2 sessions of at least resistance training per week. I would also like to emphasize on walking before and after meals, as you said, but you said we are running out of time. But we should aim for at least 10,000 steps in a day. If not at one go, you can divide it. In fact, one interesting study shows that even if you move for 1.5 to 2 minutes every half an hour, instead of this structured exercise, it is possible to achieve good glucose control. And exercise helps you to get even better sleep also. So exercise is must, definitely good.
Okay, there was a just question from the audience. So I would like to ask, like, after how many minutes of meal one should go for walking, and for how long? We know that we all have a restriction of time or limitations of time. So what are your views on that?
Yeah, normal walking can be possible within 15 minutes of your meals, but maximum within half an hour, you should start walking. That makes will differ, because after half an hour, I mean, glucose will start absorbing from your
yeah.
right. So within half an hour, you start walking, and 15 to 20 minutes, I think simple walking, not even brisk walking, simple walking, you are walking in a terrace or your garden or around your block, you can have 15 to 20 minutes of walk. That's fine.
Okay. Then one question about the role of sleep. You said that you try to sleep at least 7 hours. So why sleep is so much important in management of diabetes?
Yes, sleep is absolutely essential for proper glucose control. I think sleep deprivation, in my opinion, is one of the most underrated evils when it comes to metabolic health. In fact, there are 2 interesting studies. I will go through it fast. In one study, they enrolled 12 healthy college-going guys. For first 6 days, they were only allowed 4 hours of sleep. And what they found was interesting. Just sleep deprivation for only few days had made them pre-diabetic. In another study, they observed that just reducing sleep for 1 hour for a few days can make the person insulin resistant. Fortunately, in both the studies, changes were reversible. But if we are chronically sleep deprived, then our glucose metabolism will definitely be dysregulated. And if sleep is disturbed, there will be surge in stress hormones like cortisol and catecholamines. And sleep deprived person will always make unhealthy food choices. So quality and quantity of sleep, absolute crucial in diabetes management.
Okay, then one practical question, that during your journey of like this diabetes control, how frequently do you measure your blood glucose? Do you have a glucometer at home and you measure like twice a day, thrice a day, or you measure only glycated hemoglobin, that is every 3 months?
I am having glucometer at my home, but I am not measuring it quite frequently. I measure my HbA1c religiously every 3 months since my diagnosis. And regarding this glucometer measurement, I do it once or twice in a week. I think once a week only. 1 week, I think I'm measuring my fasting sugar. Another week, I am measuring my postprandial sugar. Randomly, I even measure my pre-dinner and post-dinner level also. So I can get idea of overall control of my sugar.
So it's not necessary to have a glucometer and to frequently monitor the blood sugar level for this strategy.
No, according to me, it's not necessary. HbA1c gives good idea of 3-month coverage. And then if you are going for lab, you are not having glucometer. So once in a month, you should go to labs to measure fasting blood sugar and ppbs.
Okay, then another question. I'm sure that some of us, after listening to your encouraging talk, will start using these strategies. How frequent or how fast can we anticipate or expect changes? Because everyone is concerned about the result and we want to improve our glycated hemoglobin or the blood sugar level. So can you tell them some brief time interval where they should expect improvement?
Friends, there is no shortcut. We have to apply continuously all above measures. And as I said, you can assess your sugar control only after 3 to 6 months by knowing your HbA1c. So in my case, when I started multifactorial approach and working on all pillars, that is rest, movement, proper eating and relaxation, I got desired results after 1 year. And then to further enforce my control, I applied those glucose hacks, as I have said, suggested by Jesse, and followed the book Circadian Code. And I was able to bring down my HbA1c to non-diabetic level within 6 months. So it's not a shortcut, but within 6 months to 12 months, if you measure all those, hacks and your lifestyle modification, you can get results, definitely.
Okay, then another question is like, is there any side effect of this restricting the carbs? Does it lead to any problem, fatigueness or something like that?
Yeah, it's an interesting question. By restricting carbohydrate, definitely I have reduced about 3 to 4 kgs in 6 months. My BMI is about 21 now. Previously, it was 23.5. So in initial years, I have reduced a lot, about 7 to 8 kg. But during last 6 months, I lost 3 to 4 kg. But I am feeling more energetic than before. So in a way, my weight loss can be considered healthy side effect more of my dietary restrictions, no other ill effects.
And at this point, I would just like to add that for Asians and for Indian, the BMI less than 23 is recommended because Indian society is prone for diabetes. And that's why, unlike USA, the upper limit of safe or normal is 23 for us. So 21 BMI is really a normal BMI for all of us. And the important thing that we don't feel weakness with these measures. Now, do you think that how long this change or the remission will last?
As long as
I know that it's difficult to say at this stage,
but as long as I do all these things. So, friends, it's not an easy thing. You have to follow. Even you have to start only those things that you can follow throughout your life. It should be your healthy lifestyle. It should be part of your life. It's not shortcut you do for 3 months and then forget. No, continuous lifestyle, all advocated measures should be followed.
Okay, and then like every diabetic, if they follow this guideline, will be able to stop their medicine. Do you think it is possible for everyone?
Nice, very good question. It depends upon the age of the patient, duration of the diabetes, and other comorbid conditions like coronary artery disease, kidney disease, and obesity. And it's also important to know why diabetes occurred in the first place in order to predict the outcome of our modifications. If the cause is genetic, it might be difficult to reverse or keep in remission. But it was due to faulty diet and lifestyle. It can be definitely reversed or in remission following all pillars. So in my opinion, if long-standing diabetes is there and at the time of diagnosis, organ damage like retinopathy, nephropathy, coronary artery disease already there, those patients will definitely need drugs to manage their diabetes.
Okay, so I think that already we have 50 minutes. We can take few questions. So let's have audience can either unmute themselves and ask questions, or you can write in a chat about your question.
Hi, Dhiren. Can I ask now?
Yeah, please.
Like my metabolism is like that. I need to have some food every 2 hours. And I am having a drug, very minor drug, glyphosate 0.25 mg or something, only once a day. So what to do? I need to eat anything like every 2 hours I have to eat something. So what should I eat?
Yeah, Karnav, can you answer that?
Alpa, good evening.
Yeah, hi.
Hi. Yeah, it was definitely, for some previous years, you have to eat every 2 years, 2 hourly. But as I said in my talk, if you take proper meal that is containing a healthy portion of protein, fibers, and vegetables, so you will be fuller for more hours, 4 to 5 hours. If you are taking more carbohydrates or simple sugars, then as I said, insulin spike will be there, then there will be crash and you will be again hungry. But you have to take proper meal healthy serving of fibers, vegetables, protein, and as I said, healthy fats. Start taking those all measures, healthy food, increase your protein intake, fiber intake, fat intake, and then there won't be any requirement of eating every 2 hours.
Okay, so I need
basically-
to list out what the things are, like what is protein and what is
Yeah, what is
carbohydrate.
lacking in your meals? You have to
Yeah.
increase your healthy fat, protein, fibers, and vegetable content of your all meals.
Okay, thank you.
Dhiren, can I ask a question?
Yeah, Dr. Rao, please.
Yeah, Karnav sir, of
Yes,
late there has
Bijlani.
been a lot of information coming on avoiding milk and milk products, like being vegan. So you find any advantage in being off milk and milk products?
If religiously or culturally, if you want to follow vegans, then it's okay. Otherwise, even American Association removed the restriction over dairy fat. Dairy fat in moderation, it's absolutely good. And if you are strictly following vegan, then there are chances of deficiency of iron, calcium, zinc, selenium, this B12 deficiency. So I think, according to me, if no restriction of this, your cultural belief or environmental concern or religious
Then
belief,
you could take it.
Yeah, you could have milk. As I said, I am having about 300, 400 ml milk.
Yeah, that's
and
what
one more
I
thing,
realized.
Yeah, 400 ml. And you should take whole milk, no skim milk, full fat milk.
Right. Good enough. Thank you, sir. Thank you.
Okay.
Yeah, Meenakshi, when you had a question.
Good evening, doctor. That was wonderful. Feels so good, especially
Good
since my diabetic number is like 6.2 right now. But what about the fact that a lot of people are saying, oh, till 7 it is not diabetic. All these figures are wrong. Earlier it was like 5.5. Now it's like 7. So what are the, when people start fluctuating, cholesterol levels keep fluctuating, and there are new numbers that keep coming. Pharmaceutical companies talk about so many things. So what is your take on this? What is the actual figure? If it's 5.5 exceeds, you're diabetic, pre-diabetic?
As Dhiren said, standard criteria is above 5.7 is pre-diabetic, above
Right.
6.5 is diabetic. But one important thing which is coming, after when you reach 5.7, already 10 to 12 years have passed of your raised insulin. I think non-medical attendees were there, so we were not discussing insulin resistance. But one terminology is there, pre-diabetic. Even before you become pre-diabetic, your body increases insulin level and your body will be insulin resistant at the time of your diagnosis. So ideally, your target should not to reach till 5.7 if you are non-diabetic. And if you are diabetic, try to come below 5.7 and try to maintain at the level of 5.7. Because only glucose level is not important. Insulin level is also not important. We have not covered everything about other aspects like insulin. Fasting insulin is also important. We have to measure our fasting insulin also. It should be low. Not only your fasting sugar is low, should be low.
Yeah, but Meenakshi madam, like 7 is not normal. So we need to bring it down to our normal level, at least less than 6.5, preferably less than 5.7.
But this is what like this, like, you have a news item, some medical recommendation talks about these numbers, and then everybody is very happy that till 7 you're fine and you can eat all what you want. But I presume
No, please don't go with that idea.
But
no, it was there in the papers.
Yes,
There in the
Meenakshi
news.
ma'am, but if your HbA1c always 7, the chances of long-term complications are more. If you are
That's right.
keeping your HbA1c less than 5.7 or 5.5, there are very remote chances of long-term complications.
That's right. Thank
Dr.
you.
Raghavendra, please. Dr. Raghavendra, please.
Yeah, sir, Karnav sir, excellent talk.
Thank
And
you.
my question. Hello. Yeah.
Nice. Yes.
Am I audible?
Yeah, please go ahead.
Please go ahead.
The three things that you have described, the most important three pillars of control of diabetes, that are exercise, control of meal, and good sleep. So, if I want to give you a number of 1, 2, 3, how important are these three things in your opinion? So, can you please tell that? Thank you.
One more thing I think we have not covered, that is stress management also. That is also important. All pillars, all four pillars are important. How you eat, how you rest, how you move, and how you relax. Those are interconnected. Diet, definitely, I will give first number. We have to control our diet, because we have to control simple sugars, simple carbohydrates, and added sugar. So that is number one. And other three are simultaneously, because they are interrelated also. If you are stressed, you are sleep deprived. If you are sleep deprived, you are making unhealthy food choices, and then your food also will be disturbed. So all four are interconnected. First thing, diet. Other three are at par.
Okay, thank you. So now we are coming to the end. So we will take a last question from Alpa, and then we will end our session. Yeah, Alpa, please.
Dhiren bhai, can I ask a question, please?
Yeah, first Alpa,
Hello.
and then we will. Yeah, Alpa, please go ahead.
Karnav bhai, is it
Yes.
walking is important, or if we do half an hour or 40 minutes of exercise, which one is better, or both should be done?
No, any exercise is better. Walking is the simplest exercise. That's how I have mentioned. You can have even moderate exercise, high intensity exercise. You can go to even gym, but standard is 150 minutes of standard moderate exercise, or 75 minutes of vigorous exercise, plus 2 sessions of resistance training or strength training. But due to easy way, I have divided. You can walk in divided phases, not at one go, or not structured exercise. Any exercise is better than no exercise.
Okay, so yoga also is considered in
Yoga is.
or?
Yogasanas, definitely. It comes in, I think, in resistance training and strength training. Only you are doing yoga, but then you should add at least walking. What I am saying, at least start 10 to 15 minutes walk after every meal. So there will be 30 minutes walk every day. You are taking 2 meals, right?
Right. Yeah. Thank you.
Yeah, Dhiren bhai, the last question.
Thank you, Dhiren bhai and Karnav bhai. When a diabetic person starts any activity for remission, he is already on some medicine. And if we try and go to a level of HbA1c to 6 or when closer to 6, will there be any possibility of hypoglycemia during the night when 12 hours no food situation is there?
No, Dhiren bhai, these all medications are very sophisticated. And I think type 2 diabetes, chances of hypoglycemia are very rare. That hypoglycemia occurs normally in type 1 diabetics. I never felt any hypoglycemic episode. And my last 3 reading in last year was 6, 5.7 and 5.6. After reducing this much sugar and carbohydrate, I never felt hypoglycemia at any time of during this year.
Yeah, but Dhiren bhai, still I would suggest you that please consult your physician that I want to go for this type of modification, and what are the dose I need to reduce about medicine. So please ask your physician first. That would be our recommendation. Don't try doing all these things without taking your physician into confidence.
I agree with
that,
you.
yeah.
My, little anxiety was that when a person is on, low dose, 24 hours kind of sustenance of insulin, and then if we try and reduce the level of HbA1c to 6, 6.5, whatever, the lower, that anxiousness was there. Yeah, okay. We can definitely talk to our physician and take his advice also. Thank you so much.
So thank you everyone, and thank you Karnav for sharing your story of bringing your diabetes into remission. And I'm sure this is going to be very useful and helpful to a lot of our colleagues. So thank you everyone, and good night, and have a
Thank you so much. Thank you so
enjoyable
much.
Uttarayan day after
Thank you.
tomorrow. Thank you everyone.
Thank you. Good night, everyone.
Thank you.
Good night.
Thank you. Bye-bye.
બરાબર હે સારું બોલાય
Yes, yes, एकदम. Video करें. Mute करें.
હાલો